Spine Institute. It is November 11, 2025. Our patient travels here from California. She came here because she's had back pain. She trusts Duke Spine Institute. She's watched our videos, and she's had family members who have had surgery here. She has two problems: a painful L5-S1 disc that's pinching the nerve going down her right leg, causing sciatica. She also has a piriformis syndrome, which is a torn muscle in her buttock. We did a diagnostic block yesterday, and sure enough, it was it helped her get out of pain, which told us for sure that she's having pain coming from the piriformis. So she wanted to have the piriformis muscle release done, and that's what we're doing today. She's here with her family members, her son, and her husband. All right, I'm just trying to get down to the 5-1 space, and you can see she's got a little spondylolisthesis at 5-1. Many patients do. It does not need fusion. Their doctors will typically tell them, oh, you have to have a fusion done. You don't need a fusion, folks. If you have a listhesis at 5-1, anterolisthesis, retrolisthesis, spondylolisthesis, you don't need fusion done. AP, you just need the Duke laser disc repair, because it's not the slippage of bones that's causing back pain. It is actually the disc that's torn causing the back pain. So our surgery fixes the disc. Let's give our audience a view of the 30 different causes of back pain. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic sciatic pain down their legs with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. Our patient is having pain from 2 out of those 30 spots, the L5-S1 disc, which is here, and the piriformis muscle. Right now we're fixing the L5-S1 disc. After we're done, we're going to move on to the piriformis muscle. You can see the herniation, how big it is. It's massive. Look at that. Show them the herniation there, Jordan. Hold on. Not yet. So you guys see that herniation, Henry? How big it is? It's sticking up.
Yes, we do.
Pushing on the nerve root. Hold on. I want to pull this back just a little bit.
Yes.
What we're going to do, folks, we're going to get in there and clean out the herniation and annular tear. Once we do that, that's going to fix her back pain here that's coming from the bad disc. It'll also unpinch the nerve going down her leg. Her nerve is getting pinched pretty bad. So we want to, looks good. We want to go in there and remove that herniation. The herniation is like a mass. It's a mass as in a big thing that shouldn't be there, pushing on the nerve, irritating the nerve. That's the nerve root, by the way, we're talking about. That's going to be the L5 and S1 nerve root on the right side. We're also going to get in there and fix her piriformis muscle. She has a tear. She's having horrible pain in the top of her buttock. We did a diagnostic piriformis injection yesterday, and she had 100% relief. There's the herniation at 5-1. It's blue. The dye we use, the Duke Spine dye, will stain the herniation blue. Let's show the audience how these herniated discs cause so much pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from our video how people get tears in the back of the disc called a posterior annular tear. And then at the same time they get the tear, which is a traumatic event, something trauma related like falling off a bicycle or falling or sports injury. When you get that tear in the back of your disc, you also crush the nucleus right next to the tear. That crushed nucleus fragments the nucleus into pieces. We call those nuclear fragments. And those fragments then work their way out through the tear during your lifetime. And it causes inflammation. Every time another piece of nuclear material works its way out, that tear, it creates another cycle of pain and inflammation. It can be back pain, it can be leg pain, it can be both. Most people, it's usually both. Now, treatments today include microdiscectomy, but microdiscectomy never fixes back pain. It only helps the leg symptoms. Most people have back pain. Like 99% of the people with a herniated disc have back pain and leg pain. So the surgery with a microdiscectomy will only help the leg symptoms as long as the surgery is done properly. But at the same time, the surgeon is removing normal bone from your spine to get down and to the disc herniation to do the microdiscectomy. The surgeon is also removing normal ligaments that hold your bones together and stabilize your spine. The surgeon is also removing muscle out of your spine or killing the muscle in your spine. So you're losing muscle, you're losing normal muscle, normal ligament, normal bone, and normal tendons during a microdiscectomy. I stopped doing microdiscectomies at Duke Spine probably 10 years ago because they just don't give the patient the best results. But they're a very common surgery. They're recommended all the time. Let's show the audience why the Duke laser disc repair is a better treatment than anything else available out there, including microdiscectomy and laminectomy. Hi, I'm Dr. Duke Machen. We've just completed our free MRI review at Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke laser disc repair. We've been performing the Duke laser disc repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. All right, welcome back. You can see from our video that this surgery you're watching, the Duke laser disc repair, pioneered here by me, the founder and creator, Dr. Duke Majan, peer-reviewed, published, FDA approved, patented. This surgery is the best treatment in the world for back pain coming from a disc problem. Okay, she has back pain coming from a disc injury. She has a herniated disc at L5-S1. But there's another cause of her back pain, and that is the piriformis muscle. It's torn in her buttock. We know that. We verified it yesterday, and that will never heal itself. It's always going to cause pain the rest of her life. So she wants that fixed while she's here. We're going to be fixing that. This herniated disc was a lot worse than I thought it would be. Now that I'm in here looking at it, look at all this. This is amazing. Some calcification, scar tissue, lots of herniation. I'm glad we fixed it. She needed it done. We were just talking about my training with Dr. Roten, who is the chairman of neurosurgery at University of Florida, Gainesville, where I did my neurosurgery training. It was the #1 neurosurgery training program in the world. Highest ranked, highest quality, best surgeons, best training for any neurosurgeon that wanted to become a neurosurgeon. As a matter of fact, every medical student that graduated and wanted to go into neurosurgery, they all wanted to go to the University of Florida. There were 1,000 applicants. They only took 2 students every year. I was one of those 2. My co-resident when I joined was Dr. Tolentino, Paul Tolentino. He trained at Harvard. Undergraduate, Harvard Medical School. He was a straight A student like me, and he and I both got accepted by Dr. Roten. So what I was talking about, Dr. Roten became world famous for 2 types of surgery. One was trigeminal neuralgia, and the other was for pituitary tumors. And what made Dr. Roten's treatments unique is, #1, trigeminal neuralgia is the most painful condition in medicine. It's like a lightning shock going into your jaw. And he was the world's #1 treatment for that along with Dr. Janetta. And Dr. Roten would do two types of surgery. One was radiofrequency ablation, where he went and stuck a needle in the Gasserian ganglion and basically burned the sensory nerves so that they stopped sending pain signals to the brain. The other was called microvascular decompression, suboccipital craniectomy or craniotomy, where he would remove a flap of bone in the back of your head behind your ear, and he would go in and get the pressure off of the trigeminal nerve, which was getting banged up by a blood vessel, like a little artery, one of the branches to the cerebellum. And basically, he pioneered those treatments and was a world leader in those treatments. So he treated pain. Okay, that was his main thing. He got famous for treating facial pain. That's Dr. Albert Roten. He was the chairman of neurosurgery. He's the one that made the University of Florida Gainesville Neurosurgery Department world famous, the best in the world. He was the leader at the helm. He's the one who recruited me from USC in Los Angeles, from Dr. Weiss. They knew each other very well. They were friends. And Dr. Weiss told him that he should hire me as a resident because I was top of my class and had a lot of potential. But we were just talking about Dr. Roten because a lot of neurosurgeons don't believe in treating pain. They don't like to treat pain. They don't think pain is curable. The only pain that they think is curable is facial pain. And we do a trigeminal nerve decompression, microvascular decompression for that, or we do the rhizotomy. And I was just commenting to my team about how so few neurosurgeons actually treat pain, but I was trained by one of the few that do. And maybe that's something that Dr. Roten picked up on, was my interest in curing pain. Just like he did. He made his career out of it. All right, any questions from our audience?
We have two questions. This first one is from Hassan on YouTube.
Hello, Hassan.
Asking, when do we say the patient needs to operate who has a disc herniation at L4-5 and L5-S1?
So Hassan, it's a great question. When do we recommend surgery? The answer really is two things. A herniated disc is by itself never a reason to do surgery, never. But when you have a herniated disc that's causing pain, either in the back or in the leg, or weakness in the leg, numbness in the leg, tingling in the leg. So basically a symptomatic herniated disc. Symptomatic means it's causing the patient to have symptoms like back pain or leg symptoms, right? That's called a symptomatic disc herniation. That's the only time you should recommend treatment for a herniated disc, is when it's symptomatic. Now, for those of you who don't know, 90% of disc herniations at L4-5 or L5-S1 do not cause symptoms. As a matter of fact, I have a herniated disc at L4-5 and I have zero back pain, zero leg symptoms, okay? So we don't recommend treating disc herniations without symptoms. Must have symptoms to treat it, to recommend treatment. But once they have symptoms, the only time you would recommend treatment is if you, as a doctor, can actually fix it. So, or you can send the patient to a doctor that can fix it, like me. So that's what I would say. As long as the patient can go to a good doctor, good surgeon, who has the ability to cure their symptoms by fixing the disc, like doing the Duke laser disc repair, the surgery you're watching right now, that's when you recommend surgery. So they have to have the need for surgery, which is a symptomatic disc herniation, and they have to have access to surgery that's going to work. Not just surgery, but surgery that's going to work. That's when you recommend it. We're done. We're going to move on to the piriformis. I'll take the last question, but there's the outside of the disc. There's some epidural fat, and we've just cleaned out this herniation. So beautiful. She's going to be going home in an hour. Any other questions?
Yes, the last question from Thomas on YouTube.
Hello, Thomas. Welcome.
Asking, does a damaged piriformis muscle have to be accompanied with sciatic nerve pain in its presentation, or can the sciatic nerve pain be absent altogether from manifesting itself in order to diagnose it?
Thomas, that is an amazing question. I love that question. Thank you for asking it. You are 100% correct. Many piriformis patients do have sciatic symptoms, either weakness in the leg, numbness, tingling, or pain going down the leg, but not all. As a matter of fact, if I had to make a guess, and I don't know the exact number, but we could actually do a chart review here at Duke Spine because we have so many piriformis patients that we've treated over the years. I would say probably 75% of the patients with piriformis syndrome have sciatic symptoms and 25% do not. They just have isolated pain in the top of their buttock, right where this X is. And we're going to be fixing that next, so please come back for the next live stream and you can watch us do our Duke piriformis release, a patented surgery that is minimally invasive and it cures the piriformis pain. Basically 99% of the pain is cured. All right, we'll see you shortly.